But now I hear the complaint that medical care and medical insurance is too expensive for most individuals to buy, even with a tax break. So this is the last symptom I want to cover, the high cost of medical care and medical insurance. Part of this is perception. People are used to believing that medical care and insurance should be paid for by someone else. But we've already gone over that issue. What else happened that did increase the real cost of medical care? Now, have you ever noticed that most people want to use their medical insurance for almost all medical interactions, whether it's a hospital visit or a well baby visit? Now, is this the same for your auto insurance policy? Do you use it when you gas up or change your oil or tune up your car? No. You'd rather avoid the things that your auto insurance policy covers, like crashes, right? Now, what about your homeowner's policy? Does anyone want to go home tonight and have the opportunity to use their homeowner's policy? No. And what about your life insurance? Are you dying to use that today? No. Insurance is generally supposed to cover catastrophic, unexpected events, such that if they did occur, it would be a financial hardship. Why is that not the case in medical insurance? Again, we need to take a history. Once health insurance was provided by the employers back in the 40s, unions began to bargain for 100% coverage of medical services in their insurance. The logic here is that if you can get the medical interactions, every one of them free, tax-free, through your employer, why spend after-tax dollars to see the doctor, even though it's not catastrophic? Thus, medical insurance became a way to pay pre-tax for all medical care instead of catastrophic coverage like most other insurance. This ended up separating the consumer of medical services into two separate parts: the recipient of service, the employee, and the payer, the employer. Normal market forces that would occur in a free market were not applicable here. Patients generally did not shop by price but by quality, and doctors and providers of services did not have any incentive to cut costs, only provide quality. Between 1945 and 1965, this mentality took root. By then, medical care was something that everyone expected to get from someone else. The model was to have the best care possible without regard to cost. Now, even at this point in 1965, medical expenses were not very inflated. They followed the general trend of other goods because, in general, people did not want to go to the doctor unless they had to, and doctors provided needed services. But as employees retired and lost medical insurance from their employers, they had to purchase private policies. For those that were healthy, this was fine and affordable. Yet, for those that had developed some chronic conditions and large health risks, they couldn't afford coverage. Even with this, there were about 7 million insured elderly and 7 million uninsured. Almost everyone still got care, and there were charity wings in all the hospitals. Now, to solve this problem, did the government recognize the problem with discouraging personal responsibility, or with tying medical care to the employer, or the problems with the market forces at work? Did they try to reverse these mistakes? Did they diagnose the problem? No. In 1965, Medicare and Medicaid was pushed through Congress by Lyndon Johnson to cover most of the medical expenses of those over 65 and of the poor of any age. What they did was give us more of the same. They said it was degrading for the elderly and the poor to be dependent on private charity. A means test is incompatible with human dignity. Thus, medical care when you are older will be the responsibility of the government, which is really the ability to force your children and grandchildren through taxation to pay for you as you get older. And if you can't afford it at any age, what was the response? Well, it's an affront to rely on the voluntary charity of the doctors and the hospitals. We instead will be compassionate, and we'll pay for everyone by forcing others to pay through taxation. On top of that, they added that the government would never dream of asking for any controls over the doctors or over their methods of patient care. All we want to do is pay the bill. So with the passage of Medicare, what happened to medical spending? The program instituted a cost-plus system of finance, which produced an incentive to build hospitals, purchase equipment, administer tests, develop new diagnostic tools and treatments without any regard to cost. In fact, the more costs a hospital incurred, the more money they received. This produced a tremendous influx of funding into medicine. The cost of the program grew well beyond projections and continues to do so, with the underlying principle being that everyone is entitled to the best medical care that exists regardless of cost. How could it not? There are many consequences to this, but I'd like to focus on one, the claim that it is advanced medical technology that drives up medical costs. Technology by itself reduces costs while improving everyone's life. I'd like to quote from an excellent presentation titled Medicine, the Death of a Profession by Dr. Leonard Peikoff, which illuminates this point. Quote, "The normal pattern exemplified by the automobile and the computer industries is that new invention a new invention is expensive at first so that only a few can afford it. But inventors and businessmen persevere, aiming for the profits that come from a mass market. Eventually, they discover cheaper and better methods of production. Gradually, costs come down until the general population can afford to buy. No one is bankrupted, everyone gains. Obviously, that's the system that's been working in technology outside of medicine. Ever since Medicare, when new inventions were made, such as kidney dialysis or liver transplant, it becomes immediately available to everyone. Simply invent the next cure or machine and then sell it to all the hospitals and collect your money. There's no need for the invention to focus on reducing costs to establish a wider market. The market's already there as soon as it's invented. This is not evil, fraudulent, or abusive on the part of the inventor, the doctor, or the producer. This is precisely what Medicare was set up to do. The problem is what Medicare was set up to do is wrong. It's wrong to use the force of government to tax one person for the unearned benefits of others, and then pretend that it's an insurance system. Medicare's introduction into the market raised the costs of hospital stays and began to affect the cost of private insurance, and thus began a 20% annual inflation rate in medical insurance. Companies began to notice this, affecting their bottom line, and sought ways to change employees' behaviors. With the government's help, PPOs were created, then HMOs, all in an effort to reduce the choices that people had available to them and incentivize doctors to provide less care. Eventually, Medicare noticed its costs were out of control. Did they question the principle of their system to diagnose the cause? No. They just threw out their commitment to, quote, just pay the bill, and to, quote, leave the doctors alone to practice medicine. There are now thousands of pages of regulations and controls on doctors and hospitals, and hundreds of government agencies, all addressing symptoms, none fighting the disease. At this point, I'd like to summarize the history and principle. We discourage personal responsibility starting in 1942. Consequently, we eliminate a free market in medical insurance with the employer-based third-party system. And we further destroy the creative capabilities of individuals and markets to produce efficiencies by introducing Medicare in 1965, effectively eliminating free market economics in medical care. As costs spiral out of control, we begin to take away the freedoms that Americans used to enjoy. We restrict patient choices of doctors, of hospitals. We tell all doctors and hospitals what to charge for their services by law. We force insurance companies to write policies to state-mandated benefits and force them to guarantee issue. We restrict building of new facilities with certificates of need, etc., etc. Freedom of choice is unsustainable without personal responsibility and free market economics. In essence, we use the government of force everywhere, and we abandon the concept of individual rights when it comes to medical care. Historically, there is one system that produces the best value and the best product or service, and this system is capitalism. Capitalism is based on the idea that individuals can trade with each other freely, and that there's a government system in place that supports the contracts made between individuals and adjudicates problems that come about by breaking those contracts. But as said before, the government does not write those contracts. This last cause of high-cost medical insurance I'll discuss because it illuminates this point: state-mandated benefit laws. Essentially, we are all restricted to the benefit policy that each state writes. We are not free in America to choose an actuary and an insurance company and define our own policy. We can only have what the state allows. Now, you would think that at least you had 50 choices then, one from each state. No, you can only purchase health insurance from the state you live in. If another state's mandated benefits are more to your liking and the insurance companies can produce a more affordable policy, you are not free to purchase it. The cure is easy. Simply allow Americans to be able to shop for their health insurance from any state. The follow-up cure is to eliminate the state mandates altogether and allow Americans to be free to trade and develop their own policies for health insurance. If we now recall Washington's statement about government, is the government acting here as our servant in all these areas, or is it acting as our master? I contend that we have a historical wildfire of government force reaching into all aspects of our lives, and it's slowly and insidiously destroying the things we value. I believe it is time to put the fire out. Thank you.